WBRZ News 2 at 4. Today, American Society of Plastic Surgeons released their breakdown of the almost 16 million procedures done in 2014. Here it is. Breast augmentations were down, so was nose reshaping and facelifts. But the big changes came from behind. Augmentations on the backside saw a 15% increase from 2013 to 2014, while the biggest difference came in lifts at 44%. And implants, well, they were up 98%. Some patients said their Kardashian sisters were their inspiration to get more plump backside. Pictured here is Kim and Khloe. With the increase in elective procedures, so could the expenses for them. But some are looking to reduce those costs by going out of the United States to do so. Certified Baton Rouge plastic surgeon Dr. Anthony Stevens joins us now to talk about what's dubbed as medical tourism.
Yes, you know, traveling out of the country is nothing new for medical care or surgical care, but usually it's been from poor countries to the more wealthier countries, if you will, for better care. Now we're seeing just the opposite. Patients traveling even from the West, even to India, as we've talked about before, for cheaper or lower cost because, you know, face it, cosmetic surgery is not covered by insurance. And so it's hence the globalization of cosmetic surgery. And so we're seeing more and more of this as time goes on.
So it's cheaper.
It can be cheaper.
But what are the problems with this?
Correct. It begs the question, what are we really getting for our low-cost dollars over there? So people are traveling out of the country for these procedures, and they may or may not have standardizations in some of these clinics that they're offering. And so patients really need to be aware, and they need to ask the questions, what are we really getting? Is it safe? Are we getting qualified people to even do general anesthetic for us? And so what if we have a problem? You know, what if we have an infection? Are we going to travel back to the foreign country to be taken care of there? Probably not. You know, we're seeing problems even in Louisiana with patients that have had buttock injections now with infections that we're seeing here in the South Louisiana area. And so it's come back home to us even here.
And you mentioned that when they come back, that might not be covered by insurance?
Well, obviously, it's probably not covered by insurance. And so it has a big problem for these patients. One, how do we take care of them? Two, I mean, beyond just the expense of it, I mean, their health risk. I mean, some of these patients have even died because of these type of infections that we're now seeing. And so you have to be very careful about who's performing this, making sure that these clinics are accredited. Now, there are a number of board-certified plastic surgeons from the United States that have clinics abroad, and I think that that is fine, but you need to research that and make sure that those are the people that you are, in fact, going to. So it begs the question, you know, like we talked about before, is it really saving money, or are we just opening up Pandora's box to a whole other plethora of problems?
And those numbers that we read a little bit ago, I mean, just skyrocketing.
Astounding, and we're actually seeing even more. We talked about the decline of breast augmentations in the United States, but we're seeing an increase actually in Europe for breast augmentations. So we're seeing more and more of this even in Europe from like an augmentation standpoint. More the numbers are even increased over there. And so it begs, you know, why not travel to these other countries? But if we do that, we really have to be careful and make sure we're getting what we think we're buying into.
Check everything out.
Yep. Yes, twice, 3 times.
Okay, Dr. Anthony Stevens, thank you so much. You're watching WBRZ News 2 at 4. We'll be right back.